Sudden infant death syndrome. Every year, 182 families in the UK lose their child unexpectedly and with no cause to be found. That's an average of 3 babies or infants every single week.
We have all seen it.
In Merseyside, they have one of the highest infant mortality rates in England. And so, in line with Safer Sleep Week, the police force has launched a new, innovative way to try and reduce the number of sudden, unexpected deaths of infants, aka a SUDI.
Every time that child gets put down, potentially is another increased risk of them sadly not waking up again.
It's about utilising an opportunity that we have when we are in an address for whatever reason, and working efficiently with a new partnership with the NHS safeguarding teams within Merseyside to get that information to them.
Merseyside's police force will now be trained to recognise risk factors for a SUDI, which they can then report via a specialist app.
Police can often be going at a time of crisis, and they will have a true reflection of what's going on in that home. We know after you've had a baby, your tiredness can increase. We know domestic abuse can increase, mental health can deteriorate. There's lots of things going on at that time. Without police being able to notify us, a lot of that would have gone unnoticed previously. So now police can go in, identify an unsafe sleep practice, give some basic advice, and then forward that straight to us as health visitors who have got those trusted relationships with families to reduce the risk of a SUDI.
As it stands, this system is currently unique to the police force in Merseyside, but that may not be the case for much longer.
We've seen in a very short space of time within Merseyside that this can have a very positive impact, so there's absolutely no reason why it can't get rolled out further. We've already had some inquiries from outside forces, what we're doing here in Merseyside.
Sudden infant death syndrome is always a tragedy, but as awareness grows and more organisations do what they can to help, the risk can be reduced. Sophie Reaper, GB News.